People have moved on from this pandemic. Mask wearing isn't as prevalent as it was before. For someone at home watching right now, they come down, they're feeling a little sick, they go get tested, they get COVID. What changes now as far as it's going to cost them to pay for that testing, vaccines, treatments? What is that looking like in the future?
Through 2024, we really won't see that many changes because the Department of Health and Human Services instituted a bridge program, and that really should carry us in this transition to the open market through 2024. And so the same policies that you would follow or guidelines, if you were to contract COVID, you still would follow it. You need to isolate for at least 5 days. You can certainly come out of isolation if your symptoms have abated. If you remain symptomatic, certainly highly symptomatic with fever, after 5 days, you need to continue to isolate. If you must go out in public, you should have on a mask. So all of those common sense public health guidances should still remain in place. Vaccines, by and large, will still remain available. Treatments like Paxlovid should still remain available. And the United States government does have a stockpile from which to draw, and we're expecting that to last through 2024. Depending on your insurance, and we know there are different layers of insurance here in the United States, you will have access at varying levels. Medicaid should be available, Medicare should be available at no cost. Private insurance should cover the cost of these vaccines, and the vaccines will now all change to the bivalent formulation from that original monovalent formulation.
Remind us again, what is the bivalent booster or shot that we're taking now? What's it equipped to battle?
So the bivalent booster is partially the original virus, right, combating the original virus, and then also these Omicron variants, specifically 4 and 5. And so that's what this bivalent vaccine is. The monovalent vaccines now will be phased out, and only bivalent will be available for adults and children. Only bivalent vaccine.
And when you say 4 and 5, those are those highly contagious, variants, subvariants, many mutations of COVID.
Absolutely, and our predominant variant now is the XBB 1.15, but that is still part of that Omicron family, and the CDC did do a study that looks as if these bivalent vaccines are also very effective against this offshoot of the 4 and 5 of Omicron.
So bottom line, testing and treatments still out there. Things may change slightly depending on your level of insurance, private, Medicaid, Medicare, but it's still out there. We're just kind of changing some of the mechanics around it.
We are transitioning through 2024, so you still have time to get your vaccine and to get treatments at little or no cost, but it will be eventually phased out.
Daniel, it strikes me as a moment to kind of take stock of the last 3 years. What went well? Operation Warp Speed went well, and certain things did not. Things became political. We had the highest case count and the highest death toll of any country on the planet for a variety of reasons. What should be the #1 lesson America comes out of this having learned, so that the next public health crisis that befalls the country, hopefully a long time from now, we're better equipped to handle it?
Great question. Look, there are lots of lessons.